Can I say hello to everybody from Ireland?
You.
And it's fantastic to be here. Okay. Okay, so I'm delighted to be here, and thank you so much to the organizing committee for arranging this fantastic program. Your attention to detail has been next to none. It's been just an inspiration. Okay, I'm hearing myself back about a couple of seconds after, so apologies, I'll get used to it. So yeah, it's great to be here. I'm privileged to be presenting on behalf of two colleagues who are inspirations in the world of aphasia, Dr. Carole Pound, whose work I've read for many years and is just an inspiration, and Dr. Yude Ichkasin, who you've just met and who's just spoken to you. So this next session really is about a piece of work that we submitted to IARC. It's based on a presentation we submitted to IARC, and it's going to speak to you about involving people with and without aphasia as co-researchers in qualitative participatory research. So I'm going to draw on examples from Carole's work in the United Kingdom, from Yude's work in Denmark, and from my work in Ireland. And again, I just to acknowledge the Tavistock and CATS for their support with this, and of course Aphasia Access. So I suppose over the course of the next 30 minutes, which reminds me I need to start my timer so I don't go over time, I'm going to just outline some of the conceptual models in the literature around involvement, talk to you a little bit about involvement across the research cycle, drawing on examples from our projects in the UK, Ireland, and Denmark. So I hope you enjoy the session. So let's start with asking the question, what is public and patient involvement? And in Europe, particularly in UK and Ireland, and I know in Denmark, we look to Involve, which are a fantastic organization, which was set up in 1996 in the United Kingdom. And they have been researching in the area of involvement for well over a decade. So they have excellent resources. I encourage you to visit their website. I give you the URL up there and have a look at those resources. There's really excellent documentation about how to co-produce research and how to work, as you see there on the screen, with people with aphasia, in our case, you know, for you and I listening today and watching, and also with members of the public, for us healthcare professionals and families. So it's about doing research with people and by those people rather than to, about, or for them. And they have this supporting statement on their website coming from the disability organizations, nothing about us without us. And I actually saw that on your Aphasia Access website when I was looking at it the other day. So I know that many people watching this are in tune with that statement, nothing about us without us. And why is public and patient involvement so important? And I'm focusing in this presentation on research, but of course you can have public and patient involvement in terms of service delivery, service design, service evaluation. We've heard excellent presentations since the start of the teach-in about all different types of services for people with aphasia and their families. But this presentation is going to focus on research. And we know now from the literature, when we look at the literature, that there's been a lot of work done in this area over the last number of years. So public and patient involvement really provides best practice. It enhances the quality and the relevance and the acceptability of the research for everybody that's involved in the project. It's also a public right in terms of accountability and safeguarding, and it avoids research waste. I suppose we're all familiar with research waste, where you can think of studies that you might have been involved in or other people might have done, where they just sit on a shelf, you know, and they're not shared with the people who were involved in creating the research, or who would have an interest in it. And that's, you know, not anybody's fault in particular, but that's just the way sometimes things happen. So having PPI avoids that research waste. And also now, I know certainly in the UK and in Ireland and in other countries, their funders are looking for PPI. Certainly there's been fantastic work done in North America and in South America indeed, and in Canada, looking at public and patient involvement. So that's another reason, I suppose, another motivator for researchers to do this kind of work. I know in Ireland on funding applications now, if you don't have PPI explained very clearly in your application, the funders are asking you, well, why don't you have it? And what are your reasons for that? This is a bit of a health warning when it comes to looking at public and patient involvement, because when you look at the literature, there are so many different terms that people use synonymously and interchangeably to describe this idea of involvement. And sometimes it gets confusing, you know, when you're trying to look for specific papers or find out a bit more about it. But I suppose it largely reflects the different perspectives that researchers have adapted to try and conceptualize public involvement. So I'm looking here at the list in front of me, and I'm sure that you're looking at it thinking, well, you're familiar with many of the terms. One that I'm using at the moment is PPI contributor. I quite like that one, but I always ask the co-researchers or the people who are in the PPI advisory group, what would you like to be called? What is your preference? And I think we should be led by that. Here's another terminology slide. And again, you'll probably look at these terms and you'll recognize many of them, and you'll be familiar with them. I know that in the US, you're very familiar with the term community-based participatory research, and there's a few others there. A little resource that I found today on the Involve website, which I'm sharing with you there, is this jargon buster. That's actually fantastic. If you go into the Involve website, you can see the URL there at the top of the slide. Look at the jargon buster, and it really was created to try and help people like you and I navigate this whole area around terminology and language related to involvement and public and patient involvement, and what does it mean. So have a look at the jargon buster. It's a nice resource. Okay, so little bit of theory, but not too much, okay? When we think about public and patient involvement, and when you look at the literature, there's a whole range of conceptual models of involvement in the literature. I've picked out a couple to share with you in this presentation, but this is by no means, the ones that I've selected, it's by no means an exhaustive list. And I'm sure that people listening to me will have other models in their minds or other frameworks that they use, and I would love to hear about those. But Ornstein's ladder of public participation is probably one of the most cited and influential models in the literature. It was published in 1969, so many years ago now, and really it's a ladder of participation, public participation, and it shows the continuum of power sharing. So right at the bottom there, you see no power, so you see the different degrees of citizen participation as you ascend or go up the ladder. So no power at the bottom with therapy and manipulation, and then moving on up to consultation, and then finally at the top of the ladder you're seeing degrees of power sharing. So to show the control, I suppose, the sharing of control and the sharing of power. In this case, it was from government to people. So this ladder wasn't devised particularly for research, but it's a very good model and cited, you'll see a lot in the literature. So a lot of models, I suppose, that came after Ornstein's ladder of participation were developed and based around that idea of a ladder, and of as you ascend, that you increase power and collaboration within the research. So here's one that I like. This is an Irish one. I was going to wear my green jersey actually, but it was in the washing machine, so had to do with the pink today. But anyway, so this is an Irish model, Irish Health Research Forum. I use it quite a lot because I like the ascending. As you move to the top of the pyramid, you're seeing the movement from no involvement, and this model is specifically for research. Okay, it was developed for research. So at the bottom of the model or the pyramid there, you're seeing none, and that would be maybe studies, traditional studies, where there wouldn't have been any kind of consultation with the people who the study was being aimed at. So you know that there wouldn't, you might think, for example, about maybe some systematic reviews, or you know, some of those types of studies where people mightn't have been involved. And then sometimes researchers are good at giving information to people. So they might say, well, look, I'm going to do this research and this is what it's about. So they give information to people. And then as you move up, you can see that maybe there's consultation, and that could be in the form of, for example, let's say a steering committee, you know, where there's a steering committee in the research, and the steering committee is advising about the research study, but they don't have any decision-making power within the research process or the research cycle. And then as you move up again, you're seeing that you're getting this more joint decision making. And the studies that I'm going to speak to you about, the Danish study, study, is actually a lovely example of how involvement can change over the course of the research cycle. Because as you know, involvement doesn't have to be at the same level throughout the research cycle. So you'll see when we talk about study in Denmark that there was, in the earlier stages, there was consultation, but then as they moved further into the study, there was more collaboration and partnership. And certainly Carole's study about friendship and aphasia is very much up there about joint decision making, sharing the power across the research cycle, and the aphasia study looking at conversation partner training in Ireland that I'll speak to you about is again a participatory collaborative study. I've included one model for young peoples, and that's just because I'm aware that there might be people watching this today that are working with young people with aphasia. So this is I like this model. It's looking at young people and children's participation in research, and again you can see over here children being involved as participants. So very much in terms of power sharing at the lower end. But as we move through the research, or through the different levels here, you can see that in these circles where there's overlap, that you're seeing an increasing level of control across the research process until you get to this final circle where the young people actually have ownership of the research. So again, it's just to give you some information about some of the other models that are available in the research. And the other thing I actually like about this model is again this overlap, because I think that involvement can change across the course of a research project, and it doesn't always have to be up here in terms of collaboration, that it can move and that it can change across the cycle of the study. So that's something that's quite nice about this model as well. Okay. This is the final model, okay? So I'm going to move away from models after this. You'll be delighted to hear. So this is, again, this is a model focused on research, and I picked it deliberately because it is focused on research. I've given you the reference there at the bottom. I don't know if people are familiar with the journal Health Expectations. But it's a journal that you'll probably be able to access through your libraries, and you'll find this paper, the paper about this model by Shippey, with that reference. So again, you can see here, it's about implementing public and patient involvement in research, and this is user engagement in research. It was a systematic review, okay, and they developed this framework from that. So here I've bracketed here, not very well, not very clearly with the brackets, but here you can see the preparatory phase in terms of the research and the different things that go on in a preparatory phase. Okay, and then we're moving to the execution phase here. And you can see here the different processes within the research that go on within this phase, okay? And you can see there the links. And finally, the transitional phase, where we're talking about dissemination, and we're talking about implementation, and we're talking about evaluation, okay? So that ends my whistle-stop tour of some of the conceptual models in the literature. There are lots more, and I'm sure that you're aware of other ones that I haven't put up there. But I'd love to hear about them if you're willing to share them. Okay, so I suppose then when we think about PPI, public and patient involvement, what are the motivations for people to get involved in research? And like, this is again coming from the literature, but I would also say that this resonates with my own experience of doing this kind of involvement work. And I know other colleagues, Carole and Yuda would agree. People want to share their ideas. They want to share their perspectives. We know this from the aphasiology literature. People with aphasia and their families want to be involved in research. They don't want to be excluded. And yet, I suppose, again, when you look at the literature, we see this pattern of exclusion of certain types, certain groups of people. So people with communication impairments like aphasia and other communication impairments, and people with cognitive impairments, their voices compared to the voices of other people, even if you just look at the stroke literature. So even if you just focus on stroke survivors without aphasia, their voices are much more heard than the voices of people with aphasia. So you and I have a job to do, and we have a job to advocate and to involve people with aphasia in research. And I know so many of you are doing that in all sorts of fantastic ways. So sharing perspectives, improving the research conduct, okay? So when we're co-creating accessible research processes together, it's so much better than just researchers creating those processes, and ensuring that the research makes an impact and has relevance, because we're all interested in relevance, particularly as clinicians, aren't we? We're always trying to make what we do relevant for people. So what do we know from the literature then about involvement in terms of barriers and facilitators? Well, here's a couple of the barriers. And again, this is the evidence base that we have. So lack of clarity on the PPI contributor selection processes. So how are people selected to be included? What is the role of people who are involved in public and patient involvement research? So if you're going to involve someone with aphasia as a co-researcher or their family member, what is their role across the cycle of that research study? And so another barrier that people have reported is that they don't feel fully prepared or supported in their PPI roles. So we can facilitate all of that. We can break down these barriers by offering flexibility, I suppose, in terms of the involvement, by doing training in the PPI tasks around what's expected. And certainly from my experience, and I know from your experience, from the people watching, we have really a responsibility to create a participatory space where we, together with our co-researchers with aphasia, can co-create accessible research processes. So like I have over 20 years experience, clinical experience of working with people with aphasia, and you know, you never stop learning. I know that you all agree with that. You never stop learning. And it's the same with the research. You know, people have so much to offer in terms of ideas around making research processes accessible, etc. I better watch my time. Okay, so these are the projects UK, Ireland and Denmark. The UK study conducted by Carole, as I told you, was Friendship and Aphasia study. The Denmark study looked at creating a cohesive pathway for people with aphasia, primarily used qualitative methods. And then the Irish study was a conversation partner study looking at evaluating the conversation partner training program from perspectives of people with aphasia and others. So when we talk about the research cycle, and we've talked about it now, you know, as we looked at the involvement at the conceptual models, people with aphasia in these projects were involved throughout the research cycle. So I just draw your attention there to that top picture. They're coloured stones, and they co-researchers with aphasia in Carole's project, the Friendship and Aphasia Study, used those coloured stones. They brought them themselves, it was their idea, used those coloured stones to identify and to share their thoughts about friendships and different types of friendships, and you know what they meant to them. So just a lovely example, I suppose, of really innovative methods and materials. And you can see across the different pictures there, you know, people being actively involved, collaborating in the research process, from right over here, generating the research questions, to the data co-generation methods, the methods used, to interpreting and analyzing the findings, and then to deciding what were the important outcomes. So people with aphasia were involved in all the different phases of these research projects. And this is, I'll come back to this lovely diagram, but it's a forest of friendship diagram that was again created in Carole's study about friendship and aphasia by the co-researchers with aphasia. Okay. Within all of the research projects, the Danish, the Irish and the UK study, there's cycles of action and reflection. And what do I mean by that? I mean that there's planning that goes on in the research team, okay, with the researchers with and without aphasia, acting and observing, so doing, trying something out and then reflecting on it, and then revising the plan, and then going through the cycle again. So these iterative cycles were a feature of all of the different projects, and they were really important because it was these iterative cycles that created and where decisions were made about the different phases in the research studies. So the research studies, each of the studies actually had 3 different phases, but these phases weren't predetermined phases. They evolved and emerged through this pattern and cycle of action and reflection. We tried in all of the studies to look at co-analysis, and we encouraged involvement of co-researchers with direct experience of the research topics throughout the research process. But co-analysis is one of the really challenging areas in the cycle, in the research cycle, because the data is messy, because there's a lot of volume of it, because there's different materials involved, particularly if it's qualitative type research. But certainly in the UK and the Irish studies, the co-researchers with aphasia were involved in the data co-analysis. And here you can see the friendship and aphasia study, some lovely pictures with the co-researchers co-generating and co-analysing data. So you see there exploring, so the co-researchers explored what friendship meant to them, who were the friends, what was important, and this whole idea of those lovely coloured stones emerged there from that. In the innovation phase, people arranged lots of events. So the co-researchers with aphasia arranged different events. There were, I think, 22, Carole, I need Carole to correct me here, 22 different co-generation meetings and discussions around co-generating data and co-analysing data across this research cycle. And this lovely, as you see here down at the bottom, this lovely forest of friendship of aphasia was created, this mind map, if you like. And it allows such flexibility because people could move data and change their minds, and it was always emerging and evolving as they went through. And the co-researchers with aphasia made decisions about how they would share their research, how they would disseminate it, and they had lots of lovely ways of doing that through dance and through drama, through different pictures, etc. So very innovative. Here you see pictures of the Irish co-researchers. So we're involved here in data co-analysis, co-generation and co-analysis. Again, in the Irish study, there were 3 phases. They weren't predetermined. They evolved as the study went on. There were decisions made within the research team. And you can see here people using all sorts of materials, pictures, stickies, charts, to generate ideas in response to the research questions and to analyse the ideas together in the group. And there were lots of really fantastic elements in terms of co-design where, for example, co-researchers said, let's use the same colour sticky for each person in the group. And so then if the people with, some of the co-researchers had difficulty with reading, but they could always identify their color on the charts. And that was just a really simple example of something that the co-researchers suggested. We implemented it straight away, and it made a difference to them in the research process. Here's the Danish study, another fantastic study, which was really about developing better care and clinical communication pathways for people across the care pathway, if you like. So moving from what we call the acute care sector, so the hospital, when the person has had their stroke and they're in hospital, right the way through to rehabilitation, right the way through to community care. So thinking about that care pathway and trying to support cohesive communication for people with aphasia and their families across that whole pathway. And in phase 1, in this study, it was primarily qualitative work, and the co-researchers, the people with aphasia, weren't involved at this stage in terms of decision making. They were consulted, but as they move through phase 2 and now into phase 3, you can see that there's much more co-design happening and people being very much involved in decision making around what's important to carry forward. I think there were 7 different ideas emerged from the phase 1 research moving into phase 2 about what was important to implement. So for example, I'll just give you one example. Conversation partner training was one idea that was decided upon with the research team and is being progressed. So what are the examples of processes underpinning PPI? So things like, for example, collective grappling with data over time, allowing sufficient time for meetings, so time for recapping and revisiting discussions as a platform for moving on, time to hang out with the data, to hang out with the charts, the pictures, the stickies, the stones, whatever it is, time to review and reflect upon the new ideas that might emerge, and then using lots of visual tools to revisit and amend intended meanings, reposition data, having new insights, allowing those new insights to become part of the data. And I suppose one of the other key things that I know Jutta and Carole would agree with is that well-formed relationships is key. So you can't underestimate the importance of relationship building in the research cycle, particularly in phase 1 and as you move all the way through with your co-researchers with aphasia and their families. So building trust, having discussions, constant discussions, not just a discussion at the start and not to be revisited, but constant discussions about power sharing, about inclusivity, about reciprocity, about power sharing, you know, all those sorts of things. And you know, certainly as a researcher, constant reflection on my value system, on what is it that's so important why is it so important to involve people with aphasia and their families in this research, letting go of control and allowing the research to emerge, to be co-created in these participatory spaces. So our findings, how am I doing on time? I'm not too bad. Our findings across the 3 sites, I suppose the 3 projects demonstrated that people with aphasia can be involved centrally as co-researchers, enhancing the equality, the accessibility, and the authenticity of the research practices, and that conducting research with co-researchers is possible if the academic and the lay researchers work together to co-create participatory spaces. And I'm anticipating Todd's question at the end about what's the key message, Ruth, that you want people to take away. This is the key message, Todd, that it is possible to conduct research with co-researchers with aphasia and their families, as long as people work together to co-create participatory spaces and allow the research to emerge in a meaningful way, a meaningful and respectful way. So in the Friendship and Aphasia study, the co-researchers produced a model of friendship and aphasia and prioritised key messages to share with people with aphasia, their families and their friends, and indeed the healthcare practitioners. The co-researchers reflected on the value of using participatory relational methodologies, and that's these participatory relational methodologies to explore complex post-aphasia relationships with friends. And I know that you had some discussion about aphasia and friendship this morning with Nina. Conversation partner training study, what did we do? Well, they went way, the research went way beyond our original aims. We agreed and prioritized evaluation criteria for the conversation partner training program, and we also looked at implementation of that, shared understandings and working with other groups. And the care pathway study, the co-researchers generated a catalogue of ideas for really creating cohesive aphasia-friendly care all the way through from the acute care setting right into the community. And the co-researchers reflected on their experiences of generating content for a partner training program. And Yuda is going to talk more about that to you tomorrow, so don't miss that presentation. It's going to be a good one. So key take-home messages, let me just pick one. I'm going to pick the last one because I'm conscious I have a minute and a half left. There's a lot of challenges, I think, in doing involvement work. And certainly, Yuda, Carole, and I would all say to you that this type of research takes a lot more time than you will anticipate. So allow yourself the time to do it and to develop those relationships with your co-researchers. So there are challenges, but it's really creative and it's so much fun. And certainly the fieldwork component was absolutely, without a shadow of a doubt, the best part of doing the PhD. I'm sure other people will say that as well. But I think that PBI and participatory, qualitative participatory research can really help to reveal the different layers of understanding and the different perspectives of understanding that really we'd totally miss out on if we didn't have the involvement of people with aphasia and their families in research. So I think I've put in a little selected bibliography, so it's not exhaustive again, but if people want other references, you're very welcome to contact me, and we would love to hear any comments or questions that you have. Thanks so much. I'm going to stop sharing my screen here now.
All right, thank you, Ruth. Can you still hear me?
Hi, Jess.
Hi. We actually have a question that came in.
Okay.
Before we go on. So what strategies do you have for the researcher to truly step aside rather than direct the research process?
I'm not hearing you, Jess. Is it in the chat?
It is in the Facebook chat, yes.
Okay.
Can you hear me now?
What strategies do I have?
For the researcher to truly step aside and facilitate rather than direct the research process.
Okay. Do you want me, am I still live? Or?
You are, yes.
Oh, I am. Oh, sorry. Sorry, everybody. I'm getting the feedback thing. I'm not sorry. So what strategies? Yeah, I think it's a really good question. And I think it's all about that, the value system. So it's about having the value system that you're going to, that you're letting go of control and you're creating that participatory space to co-create the research strategies. So you might have ideas as the researcher, and certainly I would have had ideas about what might work, but it's about involving the co-researchers with aphasia or the other stakeholders, if it's family or healthcare professionals, about also getting their ideas. In the methodology that I used, the methodological approach, which was participatory learning and action research, there's lots of different techniques within that approach, a basket of techniques, if you like, visual techniques, flexible techniques that can support the discussion, I suppose, around those things. And I know Carole would have experienced the same with the PAR work, and Yuda as well in her work with the qualitative and the participatory elements she used.